Thank you, Mr President. I beg to ask a member for the Department of Health and Social Care what impact the number of new prepayment certificates issued will have on the predicted savings from proposed changes to prescription charges.
On the member for the Department, Mr Morehouse.
Thank you, Mr President. I thank the honourable member for his question, but I have to say from the onset that this question is almost impossible to answer with any accuracy. At this point, the Department has considered all of the responses to the public consultation on the General Scheme and Charter, and reports summarising these responses will be made available very soon. The Department has not decided on the best way forward. Therefore, to make assumptions about what prescription charges will be, will change to, the size of any change and the subsequent impact on the uptake of prepayment certificates would be premature. There is little comparable data available as to how many patients purchase prepayment certificates. Currently in the UK, it's believed to be between 4 and 5%. On that basis, with the Isle of Man being a small community with a relatively good communication network, it's likely to be higher here. And of course, with a lot of publicity recently about the availability of prepayment certificates, which might encourage people to purchase them, I am, however, able to advise that at the 30th of November 2017, 2,143 valid prepayment certificates had been issued.
Mr Ashford.
Thank you, Mr President. Can I ask the member for the Department, in relation to the prepayment certificates, in answers given on the 19th of September, the Minister stated that the income for the year ending March 2017 from prescription charges was £692,481. But we know from answers given in October that in September and October alone, 350 prepaid certificates were issued. So the Department must have some idea, with the rising number of prepayment certificates going out, what impact that's going to have on the potential £3.86 million saving that their initial proposals, that's what I'm talking about, the initial proposals that went out to consultation, what that effect that will have on those proposals.
Mr Morehouse.
Thank you, Mr President. In terms of making clear and accurate forecasts on these figures, it's quite difficult. Just in terms of the number of certificates bought, in July 2017, there were 125 of these bought. That was down from 220 in July 2016. There is a lot of variety and movement regarding this. We've also got difficulty in terms of the uncertainty in terms of what the Department is going to do in terms of the changes. So at the moment we have got figures, we've got indications, but we haven't got the level of clarity we would like.
Ashford.
Thank you, Mr President. So to cut through it, can I ask the member of the Department, is he basically saying that the Department has no clue how much any changes that they do to prescription charges will actually save the Department? Is it just a figure in the air and they won't know until it's implemented?
Mr Morehouse.
At this moment in time, it's quite difficult to give any accurate data. We have got certain figures which have given us indications going forward, and when we were coming up with the initial plans, there was data that was suggesting there would be a substantial amount of money raised. But that hasn't been the key priority. At the moment, the key priority is to make sure that going forward we get a system in place that people are happy with. So that's what we're aiming to do.
Final supplementary, Mr Ashford.
Thank you, Mr President. So can I ask the member of the Department, is that a yes then?
Morehouse.
Mr President, it would be wrong of me to say yes, we've got no clear answer, but coming back round, we've got a variety of answers, and it's going to be dependent upon what actual course we come up with early next year.
So yes.